So have you ever developed chronic shortness of breath or a chronic cough? These symptoms can be because of something called obstructive sleep apnea, which is basically a destruction of the lung tissue, and you won't be able to exhale the air that you breathe. The risk factors for this condition are cigarette smoking, air pollution, occupational chemicals, dust or fumes, genetics such as alpha-1 antitrypsin enzyme deficiency, or family history of a COPD. And there are different stages based on how much air can you get rid of when the one that you inhale. Normally, we are able, like if we inhale like 6 liters, let's say we're able to exhale 4 or 5 liters, around 80% of the air that we inhale, we're able to exhale. If you are, the less air you're able to exhale, the worse your COPD. And there is a test for that, it's called spirometry, assess the flow, how much air can you exhale after you inhale. So if you inhale, if you can only get rid of 30% of the air that you inhale, that's a very severe COPD. And people, we see that in the hospital all the time. People come in and they get admitted for treatment. And one of the important tests that we do is that checking for your blood gases, how much oxygen, how much carbon dioxide, and what is the acidity of the blood. And is there any change in mental status? What is the oxygen saturation, right? And the treatment, usually we give inhalers, bronchodilators to dilate your bronchioles to maximize the amount of air that you get. And some of them, the other drugs are muscarinic antagonists, also help with the breathing. Sometimes because it's a chronic inflammatory process, we give a steroid just to calm down the inflammation in your lung. And there are other medications as well. And based on your arterial blood gases, like if you have high carbon dioxide in the blood, then we use something non-invasive pressure ventilation. It's a mask that helps you get rid of the bicarbon, the sodium, the CO2. If you have low oxygen in the blood, then maybe you need oxygen support. That's why you see a lot of people walking with oxygen. You know, they need oxygen 2 liters, 3 liters, different based on the patient. And very important to have them vaccinated against influenza, pneumonia, and COVID-19, because these patients, when they get sick, they get really sick. It's not like a regular person, when they get the flu, they recover in a few days. These patients, when they get it, it can be life-threatening, especially if they don't have good lung function. And